Good morning, everyone. Today, we are excited to share High Cycle, a new, simple, and engaging way to talk about periods. We are service design students at the University of the Arts London. Our diverse perspectives have led us to approach periods in a way that is inclusive, thoughtful, and culturally sensitive. Why menstrual health, you ask? Because it affects 50% of the world's population, yet in Tower Hamlets, it remains severely overlooked due to stigma and limited support. Which brings us to our research question: how might we facilitate open conversation, systemic education, and trusted communication about menstrual health amongst families in Tower Hamlets? To explore this, we conducted interviews, tested co discovery tools, and collaborated with organizations, professionals, and community members to deepen our understanding.
Our interviews led us to three key insights. First, many people deal with periods alone due to lack of understanding and empathy from anyone. Second, information about periods is often too medical and feels hard to understand or explain. This makes it inaccessible for many people. Third, periods are still deeply surrounded by stigma, even as a new generation of parents wants a better, more open future for their children.
This sentiment was also reflected in our secondary research, including demographic research, medical research, literature reviews, and academic studies.
These insights helped us identify three clear opportunities for change. First, the lack of understanding showed us the need to build empathy. Secondly, the prevalence of limited and highly clinical information highlighted the need for a more holistic and accessible approach. And lastly, deep rooted cultural stigma revealed an opportunity to create a more open and supportive environment for the next generation.
This defined our leverage point. We choose to focus on women aged 20 to 30 as a key knowledge carriers for children aged 8 to 12. By intervening at this point, we aim to build knowledge, empathy, and share understanding around periods in next generation. So we would like to introduce a new way of talking about periods. And welcome to High Cycle. High Cycle's mission is to make periods education accessible, inclusive, and engaging for children of all genders, and the adult who guide them. So, who is High Cycle for? High Cycle is designed for modern nuclear families, mothers, fathers, sons, and daughters who want to talk about periods openly and with confidence. This is also for schools where teachers can use the tools to explain this concept and engage with this sensitive topic more easily.
Following our mission, we designed a three-phased user journey. Our journey starts with marketing and educational resources in public spaces. These materials are designed primarily for parents. By placing these resources in everyday environments, we aim to reach adults before conversations even begin at home or in school. We designed the posters as one of the entry points to intrigue, engage, and activate parents without overwhelming them with information. The other entry point is educational zines. The zines are intended to be distributed in idea stores and GP settings, with a primary focus on parents as the key audience. The second touch point is home based gamification. The High Cycle board game is designed as a family friendly way to learn through play. It includes a board, cards, a zine, and a facilitation guide to support open conversations with children. The zine helps parents start an open, approachable conversation about menstruation. The board game uses shared play to make learning and discussion feel natural, and the facilitation guide supports adults with practical prompts for age appropriate conversation at home, school, and during play. Last but not the least is the school curriculum. The High Cycle card game. It includes discussion and Q&A cards, a facilitation guide for teachers, and an introduction zine. The cards help people talk about periods in a simple and friendly way. This is the school version. It has a zine for pupils, a teacher's guide, and cards to support class discussion. It helps students build knowledge and more positive attitude about periods.
We know meaningful change takes time. It can begin with accessible education and marketing, then grow into a family board game as resources increase. In the long term, we aim for it to be embedded in PSHE, helping normalize periods and build empathetic conversation across schools. We tested our board game in Idea Store at Whitechapel. Participants found the game to be enjoyable and easy to understand. They said it reduced the awkwardness and shame around the topics. Feedback also suggested the opportunities to improve accessibility, visual, and portability. Our next step is developing a digital version of High Cycle as a website. This will make the service more accessible, adaptable, and multilingual, widening its reach, and allow families, schools, and community organizations to use it more flexibly. Lastly, we will leave you with this. Periods shake half the world, yet we rarely talk about them with clarity, or empathy. High Cycle is our attempt to change that. We are Team 5 from UAL, and thank you for listening.